I'm recording this webinar. Before we get started, we want to share with you that we are offering American Sign Language interpretation as well as Spanish language interpretation today. And so these are the instructions, and we'll hear briefly from, I think the instructions are in the chat. And if we could just hear a brief explanation of how this works.
Si desean escuchar esta interpretación al español, tienen las instrucciones en el chat. Lo único que necesitan hacer es clic en el icono del globo terráqueo que se encuentra en la parte inferior derecha de su pantalla Zoom. Ahí podrán elegir el canal de español. Si se están uniendo mediante la aplicación Zoom para tabletas o teléfonos inteligentes, puede encontrar la función de interpretación pulsando más, o los 3 puntos en la parte superior derecha de la pantalla de su tableta o en la parte inferior derecha de su celular. Después solo necesitará pulsar interpretación de idiomas, elegir español y finalizado. Si quieren oír directamente los comentarios en inglés y español sin interpretación, no seleccione ningún canal. Es importante que hagan clic en finalizado en los teléfonos, tabletas para que funcione el canal que eligieron. Y nuevamente las instrucciones estarán en el chat también.
Thank you so much. And I see the instructions are in the chat. That's great. Thank you so much. We're gonna start today with a brief welcome from Shondell Dawson, the Director of the Family Violence Services and Prevention Office, which is supporting this webinar today.
Good afternoon and welcome. I am Shondell Dawson, the Director of the new Office on Family Violence Prevention and Services, and I'm so pleased to welcome you to this Sexual Assault Training and Technical Assistance Kickoff Meeting. The Family Violence Prevention and Services Act, American Rescue Plan Sexual Assault Supplemental Funding that was awarded in 2021 was intended to assist rape crisis centers and sexual assault programs in providing services, ensuring the continuity of services, and meeting the needs of sexual assault survivors. We are grateful that Congress provided us with the appropriation that we could allocate to states and territories so that they could issue subawards to rape crisis centers all across the country, and also partner with sexual assault coalitions and sexual assault organizations to provide training and technical assistance. We're also grateful to have allocated funding to 252 tribes to support sexual assault services for American Indians and Alaska Natives, as well as to partner with the tribal coalitions for training and technical assistance. The intended purpose of these funds are to support virtual, remote, teletherapy, telehealth services, ensure the continuity of crisis services and the assistance to be able to meet all the basic needs that sexual assault survivors have, provide supportive services, including housing assistance, healing and well-being supports, health and behavioral supports, as well as addressing any other emergent needs or safety concerns that survivors may have as it results to the COVID-19 public health emergency, as well as their overall survival of their lived experiences with sexual assault. Our intended outcomes are to ensure that there is safe voluntary access, both remotely, virtually, as well as in person for sexual assault services, to support meaningful partnerships between sexual assault organizations and healthcare providers and behavioral health providers, increase the usage of mobile advocacy services to be able to meet survivors' needs no matter where they are located in community, increase access to both health and well-being and behavioral health supports for survivors and their children, and ensure that there is enhanced supportive services available for survivors, no matter where they are located in each state and U.S. territory. There are endless possibilities for implementing these funds, from increasing health and well-being supports, increasing access to teletherapy and telehealth services in rural communities, partnering with healthcare providers to be able to make rounds and visit sexual assault survivors located in programs or sheltered throughout community, extending partnerships to hotel motels to be able to support sexual assault survivors and having access to safe housing, as well as the increased use of mobile advocacy services, as well as increasing the investments in tribal specific services, as well as culturally specific sexual assault services for survivors. The training and technical assistance kickoff webinar that you all are participating in today is intended to help you all achieve the implementation of a broad base of comprehensive services for sexual assault survivors. We are very proud to be supporting culture-specific sexual assault capacity building centers, whom you will hear from today, as well as partnering with the National Alliance to End Sexual Violence around training and technical assistance. These resources are intended to be important thought partners for you all, resources and support to provide guidance, to help provide brainstorming, so that you all have the resources and support you need to support the implementation of the American Rescue Plan Sexual Assault Supplemental Funds and continue to be able to meet the needs of sexual assault survivors. So I'm grateful for you joining us today, and I am looking forward to learning about how you all are implementing sexual assault supplemental funding in your communities and how you all are partnering with the new sexual assault technical assistance providers that are funded by the FVPSA program to be able to meet those needs. Thank you again for joining us, and I can't wait to hear more about your important work. You have a good day.
Thank you so much. That was a wonderful welcome from Shondell. And I will introduce myself. I'm Maureen Gallagher, and I am the advocacy coordinator with the National Alliance to End Sexual Violence. I use she, her pronouns, and I'm really happy to be joined today for this webinar with the sexual assault capacity building centers that you see on the screen before you. Today's presentation you'll be learning from each of our organizations about our work, as well as getting into some content around sexual violence and culturally specific services. And then we will intend to have what we hope will be a good chunk of time at the end to have a listening session and hear from you about what are the needs and wishes in terms of building your own capacity for implementing the FVPSA Sexual Assault ARPA dollars. So to get started, I also want to recognize and thank Kelly Mitchell-Clark and Betty Johnson and all of the other FVPSA team members who are here today supporting this work. So we're grateful to all be together. And before I jump in, I do just want to recognize my colleagues, Terry Poor, who's on the call today, the policy director for the Alliance, and Monica Johnson-Hostler is our executive director. So you may remember both of those folks from probably more than a year ago when you first started planning for the ARPA sexual assault funds through your administrating offices. And so here we are a year later, and we're really excited to keep working with you and learning about what might be helpful moving forward. We know that you all have had strong relationships with your domestic violence coalitions, the domestic violence programs, dual coalitions, and that in this past year, for those of you who have standalone sexual assault coalitions, this may be the first time that you've been building that relationships and with rape crisis centers. So we're very excited about that. So I do want to recognize, I see that on the slide here is the contact information for all the folks you'll be hearing from today. Joelle Engelking from the National Tribal Sexual Assault Resource Center, Mira Youssef and Nina Youssef from the National Organization of Asian and Pacific Islanders Ending Sexual Violence, Norma Ferrara from Mujeres Latinas and Acción, myself from the Alliance, and Condencia Braid from the National Organization of Sisters of Color Ending Sexual Assault. So I'll just jump right in to talk a little bit about the Alliance and our training and technical assistance work. The National Alliance to End Sexual Violence is the voice in Washington for the 56 state and territorial sexual assault coalitions and more than 1,500 rape crisis centers working to end sexual assault and support survivors. We support, through our technical assistance work, we support and respond to organizations working to meet survivors' needs. And that includes local rape crisis centers and sexual assault programs, sexual assault coalitions, funders, administrators, allied professionals. And through this project, we are holding listening sessions like today with administrators, also with sexual assault coalitions, which will guide future webinars, trainings, written materials, in-person convenings if that's possible, office hours, which we're hoping to launch soon, and a one-on-one consultation. I do want to talk a little bit about sexual assault coalitions. I'm going to drop a poll. It's an anonymous poll that will be asking you about your relationship with sexual assault coalition. So it's again, I said it's anonymous. We just want to get a sense of how you're feeling about your relationship with your coalitions, and recognize that if you're not feeling so great about that working relationship, that's something that we can are happy to support you with, work with you on. Feel free to reach out to us beyond this presentation. It looks like as folks are coming in, about 75% feel you have a good working relationship with your coalition. That's awesome. I'll just give it another second. Yeah, so that's about 3/4 of folks who responded feel like you have a good working relationship. And working relationships take time. So we're hopeful that we could be supportive of that. The Alliance has long-standing relationships with state and territorial sexual assault coalitions. In fact, most of our staff either currently work at a sexual assault coalition or have in the past. So we understand the work that they're doing in states on behalf of survivors, on behalf of rape crisis centers, including their policy work, programming, funding efforts, and concerns. We communicate with coalitions regularly through our listserv, through other convenings, through webinars, and we hear from them about the emerging issues and trends in their states. And of course, we know that the challenges are different state by state, depending on things like availability of state funding, relationships with government officials and with community partners, and that there's a lot that impacts how survivors are being served in each state, and way beyond what I can say in this call. And so, the coalitions are so critical to understanding what is happening in the states. They are providing training and technical assistance for their local rape crisis centers. They know from their programs about the needs and the gaps in meeting those needs wherever survivors are in their healing journey. They're seeing survivors, perhaps in the immediate aftermath of sexual violence, or maybe many, many years later as, an adult survivor of sexual abuse may come for services. So there's a lot that the programs are working on. And we are, happy to be available to all of you as you sort of, depending on where you are, you're all in different places too, in terms of your own experience and knowledge and understanding around sexual violence dynamics, services. And so we'll talk a little bit about that today, but we will be happy to provide whatever support we can. And I will drop my email in the chat, but please know you will have these slides. You'll have all of our contact information as you hear from each of the other organizations. And so what I will do now is pass along to my colleague, Jolene Engelking from the National Tribal Sexual Assault Resource Center. and Minnesota Indian Women's Sexual Assault Coalition to talk about their work.
Thank you so much for that. Bonjour, good morning, good afternoon to everyone. As Maureen mentioned, my name is Jolene Engelking. I am with the Minnesota Indian Women's Sexual Assault Coalition, which is both a statewide tribal sexual assault coalition that is made up of the 11 federally recognized tribes in Minnesota, as well as all of the different allies, organizations, and everybody who is supportive of, our mission to really increase access to healing and justice services within Minnesota, as well as engage in community and systems change within Minnesota. But over the last 10 years or so, in addition to the statewide tribal coalition, we have also received the funding to really expand and grow our national training and technical assistance around sexual violence and sex trafficking within Indigenous communities, including within tribal nations, as well as in urban Indian communities. And really the fact that, anywhere between 70 and 85% of Indigenous people live off of tribal lands. And so recognizing the great need that comes to all service providers to be knowledgeable about the needs of Indigenous survivors. And so we're very excited to be having this new opportunity to launch this resource center to really develop and engage folks all across the country in thinking about how we can, both within our tribal nations and within culturally designed and focused organizations, as well as in other programs, to just really be increasing the capacity and abilities of folks to serve our Indigenous survivors. And so we'll have, a series of webinars, a lot of resources, and really just wanting to form deep relationships with the various folks. So thank you for having us today. And then I will turn it on to Norma. Yes.
Yes, hello. I'm Norma Ferraro. I'm the Director of Technical Assistance at Mujeres. And Mujeres Latinas en Acción, Latin Women in Action, is the longest standing Latina-led organization in the country. Mujeres has had the honor to support the Latinx community for 50 years. Mujeres is a statewide nonprofit organization located in Illinois and a national training and technical assistance provider for the response and prevention of sexual violence in the Latinx community. Our approach is focused on developing roadmaps with community organizations based on their values and strengths. Through our resource center, and we are very grateful and excited to have this resource center, we offer a wide range of activities to support our mission. These activities include resource development and dissemination for the response and prevention of sexual violence, virtual webinars, community-based work, resource library development, training and technical assistance, and conducting research and evaluation. In the fiscal year 2023, we are excited to be focusing on listening sessions, site visits, webinars, and the development of our online library. These activities will help us to better understand the needs of our community and provide vital resources and support to those who need it most. Thank you.
Hello, everyone. My name is MIWSAC. I'm with Monsoon Asians and Pacific Islanders in Solidarity, which is the mothership of the National Organization of Asians and Pacific Islanders Ending Sexual Violence, NAPIESV. With me as well in this webinar is Nina Yusuf, which is the program director of NAPIESV, who is based in California, and I am based in Iowa. So the NAPIESV basically supports API-led organizations and also mainstream organizations in improving or enhancing their services to sexual assault victims and survivors from the Asians and Pacific Islander communities through training and technical assistance nationally and in the U.S. territories in the Pacific. We had been funded by the Office on Violence Against Women since 2011, but we are now one of the culturally specific capacity resource center that, from HHS. So we are very excited about this new funding, because this will allow us to provide more services, provide more training and technical assistance to a lot of organizations, not just API-led, but also other mainstream programs. So for this fiscal year, we are just doing a national community assessment using community listening sessions. We started in Iowa, and we also completed one in Texas and also Guam. And in 2 weeks, we're going to be in Arkansas, New York, Alaska, and then California. We are hoping that these findings from these community listening sessions will inform all of our future trainings, technical assistance, and other programming. We are also using this assessment as a way to create relationships or reconnect with organizations that we used to work with. So we would like to talk more about our work further, but this is just an introduction. So next in line, of course, SCESA, Condencia, you're next.
Is Condencia in the waiting room?
Yes, I am.
Sorry, y'all. I don't think so.
Yes, I am in the
Oh,
meeting
you are?
room.
Are you on now?
I am on now. I'm
Okay.
on the phone.
Got it.
Can you hear me?
Yes, we can hear you.
Okay.
Condencia, I would go ahead. We're not showing you in the waiting room as well, but we can hear you if you want to go ahead.
I'm sorry, Terry. Are you telling me to go ahead and present? Is that what you're saying?
Yes.
Yes.
Okay. First of all, my apologies. We seem to be having strong winds where I am, and so I think my internet connection was knocked out. So my apologies for that. My name is Condencia Braid. I'm with the National Organization of Sisters of Color Ending Sexual Assault, and I'm going to assume that our slide is up. And really, the work that we do is about providing access and resources addressing sexual assault in communities of color. We've been doing this for a number of years. We work with local programs to enhance their capacity, and particularly local communities of color programs enhance their capacity to respond to sexual assault in their communities. We very much support the buy-in for recognizing the importance of culturally relevant strategies to respond to communities as part of a trauma response to sexual assault. We have been working with, for a number of years, we have been working to provide national technical assistance around sexual assault in the Black community. We have partnered with UJIMA, the National Center on Violence Against Women in the Black community, to begin to develop resources at a national level addressing sexual assault within the Black community. A lot of the work that we've been doing will be, raising awareness and being able to truly begin to focus and address what has been happening in terms of sexual assault within the Black community. Doing, as my colleagues, listening sessions to hear directly from our community, how sexual assault shows up, what's been happening, as well as what response is needed and what does it look like from a culturally relevant lens. Oftentimes within the Black community, and we are not a monolithic community, but oftentimes that's not reflected. And so this is a great opportunity for us to go across the African diaspora, looking at Afro-Latina, African, Black, African-American, African Caribbean, across the vast majority of us from the African diaspora to begin to address these issues. And then we also will be, trying to, as much as my colleague says, providing resources, training, technical assistance, looking at issues like somatic trauma, looking at supporting the leaders that are doing this work within the Black community and the impact of the different layers of historical trauma on the occurrence of sexual assault. Thank you. And I think I'm turning it over to Mira.
Yes, thank you, Condencia. So
Thank
can
you.
we move the slide to the next? Okay, yes. So now we're going to shift. So you've kind of introduce ourselves, and now we would just like to provide a context for the reasons why we would like to start with the discussion on the intersection of sexual violence and domestic violence. This context that we will provide is based on or rooted on the experiences of the Asian Pacific Islander communities, because since NAPIESV specifically works with the API communities, that is the context where we're coming from. But in our opinion, it is similar to other BIPOC communities or culturally specific communities. So based on the work of Monsoon, which is based in Iowa, and then NAPIESV, which is our national project on the ground, and also with the Office on Violence Against Women Sexual Assault Demonstrative Initiatives, the SADI project, which we are one of the consultant for. It's been a struggle for dual programs, especially that programs serving DV or domestic violence and sexual assault victim survivors to provide effective sexual assault services and programming. This conflation of DV and SA resulted in the marginalization of the sexual assault victim survivors' need, or the marginalization of sexual violence survivorship within the domestic violence. So we just really want to start really discussing that, or just providing an introduction of why we need a specific culturally or specific SA capacity buildings, resource centers, right? Also, since NAPIESV Monsoon specifically works with the API community, we see this in the API-led organizations nationally and also in the US territories in the Pacific. So majority or all of these organizations are dual programs. So prior to NAPIESV, there was no organization led by API individuals that focus on sexual assault in the API communities. On the other hand, domestic violence and dual programs specifically serving API communities flourish nationally because since the mid-1990s, because we have to look at it historically, where in the 1990s, the API, back in the day, it was called Asian Pacific Islanders Institute on Domestic Violence, API-DV, now called API-GBV, has been supporting various programs, thus greatly improving services for survivors of domestic violence in the community, in the Asian community. And one of those recipients is Monsoon, basically. But as services improve for the DV survivor, it's been somewhat easier to discuss, to confront domestic violence, but really difficult in discussing or confronting sexual violence. So this hesitancy is sometimes not only from the victim, but also from the service provider. Now I'm going to have my partner, Nina Yusuf, to discuss this further. Nina?
So hi, I'm Nina Yusuf with NAPIESV. As Mira mentioned, that as the DV services uplifted, and that's unintentionally the services for as a survivor actually not uplifted. And on top of the comfort, the level of comfort in providing services, some of the API domestic violence services reject putting a separate focus on sexual violence because they are against compartmentalizing services and that unintentionally resulted in secondary importance of the sexual violence faced by domestic violence victim. And this is, we see it over and over again, from the domestic violence provider services. The focus is on more like overlap of DV and SA, but not really recognizing the differences. And then the victim advocate, especially working on domestic violence victim, are more familiar with the crisis intervention and with the tangible outcome. For example, restraining order, temporary housing, employment, or government benefit, but at loss in how to assist survivors who have faced a sexual assault within marriage, child sexual abuse, strangers rape, or other forms of sexual violence. We can see that for domestic violence, the goal is, or the focus is, to provide more external support, external and tangible, but for survivor of sexual violence is more internal support. There is also discomfort among advocates, especially domestic violence advocates, about discussing sexual violence within victim, and because they are not comfortable, that's then is to extract the sexual violence from the information out of domestic violence situation. So again, the discomfort can come from the advocate and also from the victim themselves. And I think that's from us. And then the next is from Mujeres, right? The need of culturally specific organization.
Thank you, Nina. What is the need that culturally specific organizations fulfill regarding sexual assault response and prevention? While many organizations work tirelessly to support survivors of sexual assault, culturally specific communities, especially communities of color, face additional challenges that must be addressed properly. These communities' unique needs and experiences determine how they respond to sexual violence and also how they engage in preventive practices, even how they entertain the possibility of a life free of violence. One important aspect of culturally specific organization is that they provide services that consider those cultural perspectives and other factors that get in the way of accessing services. For instance, services that allow for medical care for the prevention of sexually transmitted infections, or services that promote healing. In addition, these organizations can also support survivors if they want access the legal services. They can build trust more easily with survivors by creating a welcoming and supportive environment based on common cultural backgrounds and common ethnic backgrounds. This is extremely important, as lack of trust is a recognized barrier to accessing services. So these organizations have the capability to reach the most isolated community members. Furthermore, these organizations can be instrumental in developing more effective prevention efforts. By working closely with communities and gaining trust, these organizations can better understand the particular cultural mores and what is happening in specific neighborhoods, as every context is different. For instance, two ethnically similar communities can respond differently according to acculturation levels or their perception of local mainstream organizations or services. Next, please. So, what does a culturally specific anti-sexual violence approach look like? We know that sexual violence affects people from all backgrounds. Still, it is essential to recognize that a one-size-fits-all approach is ineffective when addressing the unique needs of different cultural communities, especially communities of color. A culturally specific anti-sexual violence approach addresses language and communication barriers and takes into consideration cultural differences. It goes beyond interpretation services. It celebrates cultures and employs a strengths-based approach, because recognizing and appreciating cultural traditions and beliefs can help survivors to feel empowered and supported in their healing journey. It recognizes the value of healing practices from different cultures. This helps survivors to heal in a way that is meaningful for them. Also, bravely recognizes that shame and stigma are linked to some cultural ideas that can harm survivors. A cultural-specific approach acknowledges these challenges and works to address them in a supportive and non-judgmental way. It addresses the lack of trust that some survivors may have in mainstream organizations. Also, creates safe spaces for survivors to speak up while respecting traditions and beliefs. This will increase trust and allow survivors to feel more comfortable accessing needed services and support. This will ultimately advance prevention efforts, as silence about sexual violence contributes to its normalization. Next, please. To sum up, when we talk about culturally specific approach in anti-violent sexual work, we mean a process that considers survivors' unique cultural backgrounds and experiences. We recognize that sexual violence affects people of all cultures, races, ethnicities, and backgrounds, but how survivors experience and respond to sexual violence depends on cultural factors such as language, communication styles, religious beliefs, gender roles, and sociocultural attitudes towards sexual violence. A culturally specific approach in anti-sexual violence work is about recognizing and valuing survivors' unique experiences and cultural backgrounds, respectfully and with unconditional regard. It is about providing services and resources in a respectful, empowering, and effective way for each survivor. A culturally specific approach is crucial in fighting sexual assault to improve health and overall well-being in communities of color. Thank you.
So I think before we move on to the listening session, we have 2 polls that we would like to share and for you all to respond. So Maureen, should I launch it? Yeah.
Yes. The first poll is, let me get back to them. Whether, is it launched? Great. Whether you're funding culturally specific programs currently. With your FVPSA Sexual Assault ARPA dollars. Again, this is an anonymous poll. We're just trying to get a sense overall of where folks are. Looks like 61% of respondents are currently funding culturally specific programs. Great. Thank you all for answering. And then it looks like of those who've answered, 62% are currently, 38 are not. This is helpful information. Okay. Mira, do you want me to do the next poll?
Yeah,
or?
we should do the next one.
Great. And the next one is similar to the earlier question we asked about the relationship with sexual assault coalitions, asking you all about back to it, sorry. Your relationship with culturally specific programs in your state or territory.
And I just launched it.
Great, thank you so much.
No problem. I think this is just a way for us to prepare for the next part of the webinar, which is more like us all talking together, having conversation. Okay.
Yeah, thank you all for participating. It looks like at the moment, about 69% do have a working relationship with programs, culturally specific sexual assault programs. Another 31% or 30% not currently. All right, I'll end the poll so that so we can get moving on to the listening session.
Okay. So Jolene and I will be kind of leading this, co-leading it. So Jolene?
Yeah, oh, I'm so glad that I love when we have PowerPoints up, but sometimes I like even just be able to see the different names and the amazing, depth and breadth of like who everybody is on this call. And so this is the time that I'm really looking forward to. It was, obviously wonderful getting to introduce ourselves and our new projects that we're really kind of taking and launching to help folks dive deeper into those unique needs that come with supporting survivors of sexual assault, as well as, kind of laying that baseline about why we're talking about what we're talking about today. But this is the part that really excites me, which is hearing from everybody. And I think that with so many different, communities, jurisdictions, people being represented, on this call, I am hoping that, while it can be hard sometimes because of, awkwardness of virtual environments, or sometimes not even having trust among a group, right? But really wanting to be able to hear from folks, like what is going on? What are your needs? How are we better able to support you? And how can we all be in relationship with each other to really best help, communities and survivors and all the stakeholders that come with this? And so we're just going to kind of just start off with kind of a broad but really important question, which truly, are there additional questions or concerns that we didn't cover yet that you would like to learn, to know and understand about addressing sexual assault or providing culturally specific services? And yes, thank you, Mira, for putting that into the chat. But we just wanted to take a minute and open it up to be like, what are your questions? What are your thoughts that you have at this point?
And I think what we should do is, if you are would like to speak, just unmute yourself and just start speaking. But if you're one of those shy ones, you could just like respond via chat as well. So anyone who wants to respond to that, it's also in the chat.
And if you'd like a more anonymous-y sort of way of doing that, please feel free to just like chat it to me and I'll forget your name and I'll still read it out loud.
There you go. Yes.
So I can go first. Can you all hear me okay?
Yes.
Okay. This is Judy Benitez Clancy. I am with the Massachusetts Department of Public Health, Division of Sexual and Domestic Violence Prevention and Services. And I know many of you from the couple of decades that I spent at Louisiana Foundation Against Sexual Assault, that state's Sexual Assault Coalition. So I'm really loving all of the distinctions being made, and the acknowledgement of SA and DV being very similar, but also completely different. It's always good to hear about that. An issue that has come up in our state is that with a lot of our different funding streams that we administer, is that we do have some culturally specific programs that we fund that exist to serve a specific cultural or linguistic population. However, there are also some providers that serve almost exclusively or certainly majority BIPOC populations. It might be because of where they're located or other factors, but they weren't designed for the purpose of serving that cultural group, but they sort of by default they end up doing so. And so we have a challenge in trying to figure out how to think about them in relation to the other culturally specific organizations. And obviously, this is a conversation that we need to have with our state coalition and with our provider community. And we have all of that in the works. But I just thought that I would throw it out here to see what brilliance any of you might have.
So I can respond to that.
Is that Condencia?
Can you hear me okay? Hi, Judy. Sorry, this is Condencia from SCESA.
Great.
And I think Mira, I'll take that one. And I have to say, you all, I'm so sorry that I'm not on camera. This always happens to me when I get myself all dressed up to be on camera. Then it doesn't work, and then I've wasted all this time getting myself together. Because when I'm not dressed up, you all, you wouldn't even be able to recognize me. But thank you for that question, Judy. And I think, I know Norma, my colleagues can jump in. I think one of the I think real clear distinction is when we're talking about culturally specific communities, we are talking about organizations that are created by and for the communities of color that they work with. And that's a huge distinction. They were created by and for. That is the primary purpose of the organization. And that is very different than an organization who, to your point, may be based in an area that is geographically, and we know geographics change, right? What the geographics of an area, 10 years, it can change over 10 years, right? And so sometimes you have someone, it may be I could say I was the Harlem Rape Crisis Center, which, years ago, Harlem was predominantly Black and Latina, and now it looks very different. The Harlem Rape Crisis Center was created to respond to the people that live and reside in Harlem. And as much as the program should be doing, they respond to the needs of those who live in that community. And so regardless that whatever diversity is in that community, whatever the needs of that community is, that is who the Harlem Rape Crisis Center is responding to. And that's important. And if it means that they are crafting and responding to, folks that are from the, African Caribbean community, they could be responding to folks that are from the Italian community. It's who's in that community. That is very different from an organization that was, the whole purpose of the organization was created for the communities of color. And that means their policies, their practices, all of that was created for it. So I'm going to stop there because it is a listening session and I want to try to remember that we're supposed to listen. But thank you, Judy. We just wanted to take that opportunity to kind of put that out there.
Yeah, thanks, Condencia. And I'm sure you look lovely. We certainly recognize that, by and for, that's really, really important. I think what our concern is, we don't want to be dismissive of these other programs that are largely serving BIPOC population. So we're just trying to figure out where they fit in. And I think having those conversations with them will probably be the most beneficial way to get to that. Thank you.
What about others? Do you have anything to add, or if you have the same struggle?
I would like to add something to what Condencia said. I also think that it's very important, the objective in the design of programs, because a culturally specific program has the objective of make that respond, we can say culturally, like labeling and, just because we are working with this group of people of color, but the objective of really getting to this person, gaining their trust, and having deep knowledge of those factors that get in the way for them to accessing resources and really feeling supported. So unfortunately, that a lot of people of certain ethnic background or cultural background go to some place, it doesn't guarantees that these people are getting what they need, because the objective, sometimes they go and the objective may be, like giving them something, but the objective is like the objective of supporting this person in a way that that person feels through cultural means get the support that they need. And this is obviously from design. It has to be designed with culture in mind.
Also, I just want to add to that culture is not static. It's dynamic, right? Therefore, I think we also need to be aware that of the history of migration of different communities, that there might be some, let's say I'm Filipino, me as being a Filipino American might have different needs and challenges from my mother who's an immigrant. So I think also becoming aware of those different history of migration. We just really connected to a question that came in through the chat. The question says, please say more about how the needs of SA survivors and SA programs may be different from DV. This is completely new to us. We have not worked with SA programs before. So I will allow Nina, if you have anything to say to that, and even Jolene or Condencia and Norma, if you have anything that you also want to like maybe respond to that. Nina, do you want to, because I think you already talked about it, about the internal needs of an SA survivor. So if you can kind of dig deeper on that.
Thank you, Mira. So yes, so I mean, it's not a surprise that not too many people understand or work in what is the need of SA survivors, and collapsing it into like DV. And I think in a sense, for administrator, for all of us, we need to kind of start, yes, seeing the intersection, but in also the differences, and not afraid to start to ask actually survivor, what do you need, and when we talk about survivor center, and for SA survivor, the focus in healing and justice, but we usually automatically healing is equal to talk therapy, and justice is criminal justice system, while for sexual assault survivor, it might not be that. Healing is feeling safe in their own body, and justice mean to be acknowledged that rape happened. So it can be totally different from how the approach to, in supporting DV survivors. Thank you.
I also just want to add that I think the question is for us, it's really a future. So when I say dig deeper, I think digging deeper is one of our organizations working with you for a future training and technical assistance, because just having this initial conversation is not enough. So this is maybe can be one of the ideas that we could, provide those future training and technical assistance for all of you all. Yeah. Any other maybe, are there any additional questions or concerns that you have that we didn't cover that you want to share? Because we are noting all of this in order for us to create a really a good topic, a good training topics and workshops that we can do in the future, and even future resources for it, right? So anyone else? And silence is good. That means we're all thinking. It's all good. So again, if you have any, if you want to just write it, please write it. I'm also mindful of our time, so maybe we could move on to the next question. And we could always go back to that if needed. Okay, Jolene?
Yeah, of course. I do apologize. The computer kicked me off. I feel that technology is wanting to do that to folks today. And so I believe that folks had asked the question that had come in through the chat, which is around the differences in serving sexual assault survivors, as well as opposed to domestic violence. And I will just also echo a lot of what I heard was being said by Nina in particular. But when we're just thinking about how often within programs, it's been historical and it has grown and changed, but so often within dual and multi-service programs, we're seeing folks who may have one person who feels comfortable, supporting that survivor of sexual violence, and everyone else, they get really nervous and really scared. And I think that there's both that level of, differences in laws that come in spaces, as well as that very the harm to the body, especially when you're talking about things that are related to sexuality and things like that. It can be really difficult for folks to to have comfort talking about, right, both within themselves and with others. And so there, as Mira talked about, we would love to be able to support you a little bit more on that individual level and kind of hear what's happening directly within those communities. But yeah, I think for me, what I've often seen is just that general discomfort of folks being willing to talk about sexual violence, as well as how laws and the way our organizations are framed and created really have that impact. All right, but the next kind of question that we had was around what are the opportunities and challenges you have in meeting the needs of sexual assault survivors, and then or also related, and working with the sexual assault coalitions. So where are those things that you're like, this is an area that we really want to explore more, or where are those things where you've had that little bit of challenge or a little bit of rub?
And maybe there are some states that I want to show off about their, those different opportunities that you've already have already met the needs of sexual assault survivors through the ARPA money. So I'm just kind of wondering, if any of other administrators would like to share those. So Marie, I'm just kind of wondering, those services for teens, how when parental rights factor in, then layered cultural factors, is that the challenges that you've seen?
So I think there's a lot of confusion. So I'm from New York. And so to some extent, there's some reproductive rights for teenagers. But when we're talking about sexual assault, and there's a spectrum of how folks may be a victim. It could be somebody they know, somebody they don't know. And so we get a lot of questions related to, in some sense, there's some autonomy depending on the age. And then when I say teenagers, that's pretty broad, because in some respects, at least in New York, at 13, they can make some decisions about their reproductive health, and you can't let the parent in. But then there's other factors, depending on how they've been victimized, where the parents, it may be relevant for a parent to know, be brought in. And we get a lot of questions from providers really trying to navigate that landscape of what can they legally do, not legally do. And then also, and then let's factor in some cultures, being a very diverse state, we have some cultures that teenagers, we although we've updated our laws related to child brides, for example, we still have some communities where you can see underage brides. And so it's just, I feel like this isn't a topic area that so future food for thought. I would love to learn a little bit more, because we get asked the questions and I don't think I can confidently answer those things, but it gets there's a lot of intersectionality there. So since you asked, I'm just putting it out there.
Thank you. Thank you, Marie. I think that is excellent. Anyone else? We are not here to answer all these questions. We're just here for, food for thought, things that we could like discuss further with individual state in the future, or maybe even individual organizations within your state in the future. So Jolene, there's another one.
Yes, there's a couple things that have come in through the chat. And one of the things is around, kind of one of the challenges is around the determination of what is allowable, both in how folks are able to really like convey that to folks within their state, as well as like the time that can be spent like tracking down, and the nuances and the restrictions that come with things that are allowable versus things that aren't. And so that's just one of those challenges that somebody had wanted to explore. And then the other chat that came in is, we have large regions of rural areas in our state that are served by very small victim service agencies with limited resources and staffing. How can we better support those agencies who have to focus on all types of victimization and serve anyone within their large geographic area to create better focus on sexual violence and create more culturally sensitive programming? Ooh, that is a really good question.
Really good. It reminded me of our community listening session in Guam a week ago or 2 weeks ago, where it's about like, it's basically for me, it's like a small rural, right? Island, rural. So it's kind of the same question that was brought up, or challenges that was brought up. Anyone else? Or so these are the things that we are kind of seeing right now, right? So if we are thinking about those services for teens, now rural areas, how then do we really serve rural communities, or even like island, US territories that are like island, that's really like small communities. So those are like different things that we could then think about when we are, topics and future trainings for us to provide and have deeper conversation with you all, or with each state.
And I think this is Jolene. I think one of the things that is also hard is that so many things do, like we can have understandings about, what's worked in other communities, what are maybe some, best or promising practices, and what are some ideas that folks can explore, both on that statewide level as well as on the community level. But it's hard when somebody said that, like within our communities, we're not monolithic. Within programs and states, there's so many different nuances that we're having to pay attention to. And I know that going to that rural question, previously my work was focusing under rural sexual assault response teams. And often, they are folks who are doing the best work that they can do with the resources that they have. Well, we would be promoting, folks having, standalone, you have your sexual assault response teams, and you have your CCR, and you have your other things all separated out. For some of these communities, it wasn't working. And so we'd have to work with folks to explore the ways that you can still carve out the unique times to provide both the training and that understanding, as well as the focus on the systems and social change aspects. And so I just want to say that I love this question, and we would love to explore it more with people, I think. So anybody else have any of those challenges or opportunities that they've been seeing within their regions, areas?
Oh, hello. Hello, I'm sorry I'm late.
No worries at all. Anybody else have anything they want to share about challenges or opportunities with survivors or with coalitions?
I would like to share something. My co-worker here, she lives at Mujeres, she lives in Georgia. And she told me how they are seeing so many problems in the Latino community, and in general for many members of the community, but is all type of like the way it's being described, like everything is going on at the same time. So the barriers is, all these things happening at the same time, but the opportunity is also this desire to do something, when people ask, what can we do? Is that they see that it is not possible to do everything at the same time. And that's why resources and funding to specific things is so significant, especially for sexual assault, because that doesn't happen. And usually, and what are the reasons? You know, stigma is taboo. It's taboo in general. So the resources for sexual assault is minimum. So just that there are these resources is a big opportunity for and the desire to do something to change things for better for the people is that's where the opportunities are, and we cannot, you know, be blind to that. We have to take action and do things.
Anyone else that want to share? So because this is really a space for you all to share with us, you know, anything that, any challenges or that you know, any challenges that you will have or have already when, you know, you're pushing for organizations that you are funding, that they need to work with sexual assault survivors, or they need to create programming that's specific for SA survivors. What are those, you know, are there any other challenges that you see? Or like a pushback from them? So, you know, like this is not the end of our conversation. We will have monthly office hours starting in late April for ongoing TA opportunities. I was just reminded to share that. So you might not have this, you know, like have that burning question or want to share something, but there are other opportunities that you will have to have this. So, you know, so it's perfect. Okay.
Mira.
Yes. Who's that?
I think we so I see two things. Oh, I just saw something in the chat from New York. Yes, okay. Can you hear me? This is
yes, now I can hear you.
And yes. Something from in the chat from New York, and I think, and I know we also want to hear from people. How can we provide tea and training to them? But I'm wondering, how are things going? I know a number of you came on the call today, and I'm so glad to see so many of you on the call today. And I'm just wondering, from the folks that's out there, how is it going in implementing, implementing the work around sexual assault? How is it going? Is anyone willing to kind of share just how is it working for you? Now, I should tell y'all, I used to work in higher ed, so don't get me to start calling on people.
We really have a shy group or group that need more time, which is really good because a listening session is all about that, like providing just a space. But I just want to kind of like, lift what Marie had stated in the chat about the increase in the calls in the statewide SA and DV hotlines with victims from other countries. I think when we are thinking of this work, it's also not just in the US, but also because we have a lot of immigrants that are deeply connected with our home country. So I think it is important for us then to even think about that. How then do we do this work when we have those calls, right? Because we have experienced that at Monsoon and also with NAPIESV, like even technical assistance asking like from like other Asian countries that we're from. Another question, another comment here from Tracy. There is a lot of confusion in reporting, how to separate reporting between SA and DV, because a majority of our service providers started as DV organizations. That is excellent, because we see that so much. Definitely. And then go ahead, Jonathan. You can read Mallory's.
I can totally read Mallory's. It was a slow start for North Dakota. It was a rush to get the funding out, and the applicant agencies had good ideas, but it's taking some time to get activities such as, SANE staff supports going, which is that, I think, general idea of that hurry up and wait, right? Where it seems like things are moving so fast or so quickly, and you have all these deadlines that you need to meet, and then you're like, oh, sometimes the implementation can go a little slower than we want, especially if folks are doing hiring, and especially like there's so many things that are creating some of those slowdowns, right, at certain points. And it can both be, it can feel frustrating for people on the funding side, for people on the ground side. And yes, so getting the policies in place and building partnerships, because we also want to make sure that as much as we want things moving, at a steady clip, that people are taking that time to really do the due diligence on that, the front end, to lay the groundwork and have those conversations that are so important. Because I've seen also communities who are rushing, and they don't really take that time to think about, what are those unintended consequences? Are there people that we are leaving out that really should be in this conversation? Things like that. But I think it's fully understandable that things are a slow start at certain points. And hey, there's technical assistance to help them.
And having said that, I'm wondering, one of the questions, this is condensing, and I'm wondering, one of the questions that was out there was the program separating how to report between sexual assault and domestic violence, because the majority of the service providers started as domestic violence organizations. And I'm wondering if it's helpful for us. I don't know for how many of you you're struggling, because the programs that you might be funding in your state and territory are, they started out as domestic violence organizations, and they're using this fund to increase their work around sexual assault or something along that line. And please let us know if it'd be helpful for us to do a specific training, webinar, et cetera, for folks that are dual programs that are trying to address sexual assault, or folks that are, to Mallory's questions, folks that are, trying to do SA, but really has done DV. Like, we would definitely welcome coming out and doing, having some conversations with you, doing, webinars with our partners, with the Alliance, et cetera, around that, because I think we want to be really intentional about, folks that hopefully you all are funding sexual assault organizations that's what they do. But we also know there's a number of organizations that are dual or multi-issue organizations. And as they're trying to increase their work around sexual assault, it may be a challenge. And the sexual assault work has to look differently. It cannot look the same as domestic violence, because that could create unintentional harm for survivors. So we're more than welcome to come out and do something like that. So
yes, I think that is I think a lot of us that are culturally specific, that has been a challenge for our TA providers. We've seen that a lot, the challenges of the dual programs, that saying that they're dual, but in reality they are really a DV program. So definitely we could come in and provide training and workshops in ensuring that SA victims and survivors are really provided those services.
I think that also, in addition to this idea of when you're creating policies, wellness plans, things like that, how are we also trying to take that, trying to make sure that from the very onset, our policies, programs, practices are really designed around the needs of various communities that our programs will serve. Even working within tribal communities, we're finding, that so many aren't embedded with, the indigenous values that folks are wanting to, be promoting. How, when we look at our internal policies and the ways that we intersect with other programs within our communities, are we making sure that they really meet the needs of culture-specific programs, of folks with disabilities, all these sorts of things that we're needing to be attuned to. I think that's just one of those other things that at a previous job, I developed a deep love of text analysis. So reading how what we have on paper can really speak to our values, and also are we living them out, including our job description. So when we are hiring for folks, what are we putting out there and saying that we are prioritizing and that we're looking for within our programs? So. And then also within the chat, kind of as a follow-up, it was the how to track domestic violence hotline calls versus sexual assault hotline calls. And so thinking both about, what are the ways that we're tracking, and also how do we conceptually understand the differences in those, right?
Even maybe like even the call will look different, right? So when we're thinking about hotline or helpline, even the ask will be different for DV and SA. And SA might be like a call that is silent, right? For a DV, they might say, "Hey, I need to leave the house now," right? But for SA, it's really just maybe, we just the silent, and then you're like wondering like if that person is real or not. So those are different things that we're seeing. But Janice, you unmuted yourself. Do you want to share something? I see you. Janice Mirabasi, do you have anything to say? Maybe not. Okay,
I'm also wondering, maybe.
Go ahead, Condencia.
No, go ahead, Janice. I think Janice is here.
Janice? I am just gonna say, this is why I don't like virtual community listening session. It is so difficult, but we have to do what we need to do.
And I mean, this is also reflective, I think, of the fact that like when folks are trying to be working with the programs within their community, that it is harder. Like there is both this level of accessibility and connection that we can make, right? We're all sitting all everywhere, right? But at the same point, there are still those limitations, right? Within spaces such as this. And so we do want to thank everyone, for offering what they have, but also just keep things in mind. Remember that, like, I know that we're not fully wrapping up yet, but just this isn't the end of these conversations, right? We want to be hearing from folks. We want to be here, and especially as different resource centers, we each have our own little niche and area that we kind of focus on, but we all work well together because we understand those intersections of need that happen, and that we're stronger and we're able to be working well together, right? And so just remember that you can always reach out to any of us. So, and please, we have a few more minutes, but chat things in, even if they're just like, I just want to make sure that somebody does a webinar at some point, please chat that in.
So should we then maybe go to our last one, which is like, how can we help you? I'm going to paste it. It's like, what technical assistance or training would you like to receive from us? Besides the one that was already mentioned, are there any other topics that you want us to provide you, or even create? Because I think this is a great time for us to create things that are needed by the community, because we are truly excited that there is this focus from HHS on sexual violence, and we are just, we just really want to know what is needed on the ground. You could put it in the chat.
I do want to mention, Mira, this is condensing, and I do want to mention that I think, as folks have heard, us talk, and I'm interested in finding out what kinds of things you all are funding. And I see, thank you, wellness, staff retention, reimagining services, and what that means with this funding. Really trying to think through we can also be able to provide some technical assistance around what kinds of things you need to be funding and what kind of processes do you have in place in terms of making sure that as information comes in, some of you, because of the funding that you manage at your state or territory level, you are already familiar with sexual assault. But also please know that if you would like to have a training for you or your staff on sexual assault, we can do that as well. And the Alliance, who's on here as well with Maureen and Terry, that works with the coalitions. I mean, I'm sure, coalitions would love to be able to come in and provide training if they haven't already. But if you feel like you want to increase your capacity to understand sexual assault more, and it's something that you want to have, that's something we can certainly do. We've certainly, I know my colleagues and I have done regional training, so we get a number of administrators from a certain region together. I always remember I'm really bad at U.S. geography, but I always remember like the Illinois, Minnesota, Iowa. I think y'all are close together. I think something like that.
Yes,
But something where is it Mira? Listen, I was gonna drive from Iowa to Detroit, Michigan until I realized that I couldn't do that. So I'm really bad at geography.
Yes, you can. It's only 7 hours.
Oh, okay. But if you all want to do that, if it would be helpful to have, those of you in the region for us to do some more work on sexual assault. And also, I think, also as you're looking at your processes, and how are you reviewing the information? How do you look at information to make sure that it's really talking about sexual assault and that the things that they say they're doing are really about sexual assault? So thinking about that, the policies that you have in place, those kinds of things, looking at the reports, things like that. And I think to Catherine's point, a really important thing, what to do after funding ends, because although we love this funding and we love Shondell and we know she's an amazing person, this funding does have a stop date. And so that is a very, very, very important question. What kind of plans does the state or territory has to continue some of the sexual assault work that you are able to fund as a result of this? That's a very important question and something to be thinking about with your coalition, with your communities of color programs, as a whole, and we can certainly help to strategize around that as well. Allowable uses.
I would also like to add funding for prevention, because that's a big difference in prevention between sexual assault and domestic violence. There are some commonalities, but there are some differences that need targeted funding for sexual assault prevention because the victims, the targeting people is different. So that's an important area that should not be forgotten.
All right, please things. The question again, or how to really think about those allowable uses and those different requirements. And also, I think as different things, like how sometimes things, what is allowable? How can we think ethically expand or thinking?
I think we just lost Jolene. I think she was mentioning Deidre's comment and question here about what allowable uses and requirements of the uniform grant guidance. Maybe this is something that also a training or a workshop that specifically maybe a FVPSA specific workshop, like we could have that discussion as well. And I think this is also then questions from the sub-grantees, because if the main grantee or like the grantee itself are like sometimes confused, and then the sub-grantees will be really confused as well. So yeah. Maureen, Maureen or Terry, do you have anything to add? So we only have 1 minute.
Yeah, thank you. I'll just jump back in and thank you all for that. And yes, thank you, Terry, for putting the final slide about how to connect with us. We'll also share these slides with you. And so you'll have all of our email contacts. You can reach out to us individually, and we will continue to work with each other and how we can collaborate on meeting your needs. And just would like to take this moment again to thank all of you for participating today, all of the FVPSA administrators, all of the presenters today. Also thank our FVPSA team. I saw that Shondell, I think, was on here for some period of the time, so we were happy to see her, as well as Kelly and Betty and a number of the other team members that are here. And finally, I would like to thank our interpreters today for their great work, Jeff and Dania in the ASL interpreting, and Kelly and Tamara in the Spanish language interpreting. And yeah, just welcome. We are all open to hear what you didn't get a chance to say today, what you thought of after we ended, and we look forward to working with you moving forward. Thanks, everybody, and have a great night.
Thank you.